It's an operation which has been taking place for a long time and often gives plastic surgeons bad press because of the appearance of various rich and famous and celebrity people, often from the US. In my practice, facelift patients tend to come saying that they don't like the shape and appearance of their lower face and neck. And in that situation, if they've got a large excess of neck and skin, neck and lower face skin excess around this area of their face, then a facelift is a good operation for that, but it's a big operation, okay? In my hands, it means having a general anaesthetic operation, which takes 3 to 4 hours. It means an in-hospital stay of between 1 and 2 nights post-operatively. I tend to say to patients they need to stay at home for 2 or 3 weeks post-operatively, because most of their friends and family are only interested in what's going on whilst they're at their most bruised and battered, rather than when they're looking better again. And it takes recovery time. One of an operation which I'm looking at, which isn't particularly new, but which has implications for a slightly younger age group of patients, is to do a mini facelift type procedure, which has a shorter scar and involves a scar really from the hairline at the temple coming down in front of the ear, just to the earlobe or slightly behind the earlobe, and that's it. And this involves dissection of the skin in front of the sort of ear and onto the angle of the jaw, and then tightening up a special layer called the SMAS layer underneath with some stitches, and then re-draping the skin excess, taking off the excess and stitching the patient up. And that's a procedure which takes a short period of time, maybe an hour and a half to 2 hours. It could be done under local anaesthetic. The patient can come in and go home same day. They have stitches which need to come out sometimes at a week, but there's much less downtime, and although the overall result may be less than with a major operation with more potential pitfalls and complications, their trade-off is the shorter time, cheaper operation, and it's something that can always be repeated as well. So yes, that's a full facelift operation, big operation with longer recovery time. A mini facelift is a lesser result, but maybe for patients in that sort of 40 to 50 age group might be just something that they're prepared to accept in terms of downtime.